Good morning, everybody. I am Lori Esarey. I am a family nurse practitioner from Florida. I am on here today with my friend and colleague, Kelly Engelmann, and I just want to start out by saying thank you. Time is such a precious commodity, and you've decided to spend it with us this morning. Our goal for you in this webinar today is to walk away from here feeling empowered, feeling not only empowered, but you have a wealth of information to walk away from today, take action steps, and have reduced fear and the ability to have intelligible conversations with your friends, your neighbors, and your family members. So welcome here today. We're going to get started. We anticipate about an hour. If you have questions, we're gonna answer those for you at the end. But we want to make sure that we have time to get through all of our material today. So along the way, you have the opportunity to hit chat if you want to, or you can also actually type in a question and answer. So you can provide us those questions any way that you wish to. We're gonna be happy to answer those towards the end. And we want to just make sure that we're able to get through this information today. So welcome, Kelly.
Yeah, thanks, Lori. I'm so excited to be here. And I wanted to say, just to echo what you've said, thanks for being here, participating, learning, in order to help reduce your stress. And I know that this is a very touchy subject. I know some of you have lost family members, coworkers, friends, and we understand that. And for you that are healthcare workers, I just say, I want to give you a big hug right now because I can't even imagine what you're going through day to day, because I know my phones have been ringing off the hook with questions and concerns and challenges. And so I want to empower you as a healthcare professional, as a patient, as a family member and friend. We want to empower you today to kind of learn what you do have ability to, how easy it is to get treatment and care when it doesn't seem very easy right on the surface. So thank you for being here. I think before we get started, I think it's appropriate. I know, my team knows who I am, right? But you guys may not know Lori. And I just want to say that Lori and I partnered together several years ago in developing our wellness clinic. She's in Florida, I'm in Mississippi. And, I always want to surround myself with someone smarter than me, with a different skill set than me. And I feel like our meeting was not by chance. I feel like it was very much ordained by God, and the things that she's been able to help me see in my practice and the things that we've been able to develop together. This is our first attempt at a webinar together. And so give us grace on the technology side of things, because I think that, as we work through technology, sometimes there'll be glitches. So if we have those today, please give us grace. It's our first time out here together. We've done a lot of speaking together on the platform, but not necessarily together in a virtual space. So Lori, tell us a little bit about your story, why you got started in functional medicine, and really what you're passionate about.
Yeah, well, first of all, let me say I'm so humbled by what you shared about me. So thank you, Kelly. I feel the same way about you. I know that our time that we met was God ordained for sure. So a little bit about me. I have been in the functional medicine space now for about 14 to 15 years, but actually my background is I started out as a CNA and I worked my way up to being a nurse, and my background is level 1 trauma. I worked at H. Lee Moffitt Cancer Center in ICU, in the MICU, Tampa General level 1, as well as the James A. Haley VA Hospital in cardiac ICU. I transitioned from there into the ER. So to all of my friends and all of my colleagues and my family members who are on the front lines in those emergency rooms and in those practices, hats off to you, because I know it was very stressful when I was there, let alone, we weren't living in a pandemic. But I was faced, unfortunately, at 25 years old with being diagnosed with diabetes. And I was a marathon runner at the time. And the long and the short of it is that my own medical community really didn't have much to offer me because I didn't look the picture of diabetes. And in fact, it took forever for me to get a diagnosis. I just knew that I was feeling very, very tired. And the long and the short of it was I found and fell into just this discovery and became very, very passionate about learning what to eat, why to eat, and how to apply that in a way that could actually heal my body. So today I sit here still challenged with blood sugar. That condition of dysfunctional blood sugar doesn't go away, but I'm empowered now that my labs look considerably amazing, and I live the story to help others. So my clinic here in Florida really focuses on meeting our clients where they're at, and regardless of them being 4 months old or 90 years old, my oldest client here in Florida, meeting them where they're at and helping them become empowered with the knowledge they need to take a lifestyle approach to their health. So that's what I do. What about you, Kelly? Like, how did you get into this functional medicine space?
Yeah, I think I just fell into it. You know, I worked my way up as well. I started out as a surgical tech. So I spent a lot of time in surgery, landed myself in labor and delivery surgery at Women's Hospital here in Jackson, Mississippi, where I was working both labor and delivery and surgery. I loved it. I fell in love with women's health. So when I finished my graduate degree, I managed to get a job on the Mississippi Gulf Coast in a GYN clinic. And so what I saw with my patients, I was there for 8 years and I absolutely loved it. I loved my doctor, I loved my patients. But what I saw that as they aged, despite standard of care, despite us telling them to eat less, exercise more, despite, you know, the best medicines we had available for hormone management, what I saw was as they were aging, things were not looking pretty and they weren't very happy. Right. So as a menopausal female, the things that I had to offer them initially, perimenopause, was birth control pills. And then if they couldn't sleep or were having anxiety issues, I could give them an antidepressant. And then if they were postmenopausal, I could give them a little Premarin or Prempro, whichever was appropriate, and an antidepressant. And I just felt a little frustrated that I'm like, there's got to be more of the story. I was seeing my mom age at that time. She was about going through those transitions. And so I was like, I've got to figure this out. Unfortunately, my family was also hit with a medical crisis about that time. About 6 years into my career, my husband developed a terminal cancer. And that forced me to start looking at nutrition or other ways of managing. And I started doing some research on my own. I started taking some nutrition classes. At the time, I was a marathon runner as well. And I believed it was calories in and calories out. That's how I was trained. And as I learned more, I realized, gosh, there's so much more to the story. There's so many things we could be doing to help patients thrive as they age and not go down that rabbit hole of chronic disease states where it starts with hypertension and it ends up with osteoporosis or cancer. So I opened my wellness clinic in 2004 and progressed through functional training and feel very blessed to be here. I've seen a lot of growth and transition in Jackson, Mississippi. When I got to Jackson and opened my practice, you know, we couldn't even find kale at the grocery store. You know, I felt like, you know, I was trying to live out a lifestyle that I didn't have the resources to live. And thankfully today we've seen so much progress in the ease of making this lifestyle a reality and something that's actually sustainable as we move through. So that's my story.
So the question is, I'm sure you're asking everybody on here today, is why are we doing this then? And how did this come about? And how did the conversation about coming to, you know, a larger audience, if you will, although we've been in front of large audiences before, but together on a webcast just like this. So Kelly, tell us a little bit about how this came to fruition today and why.
So I have to mention Synergy to do that. So Lori and I started a company a few years ago called Synergy. And our mission for Synergy is really to bring information directly to providers and to consumers regarding nutrition, functional medicine, hormone balance. And when we started walking through this journey with treating patients and helping them navigate the healthcare system today in regards to COVID specifically, you know, we stumbled upon information that we're like, we need to get this out. And so one of the things that we did last week in my clinic, we've been keeping you guys updated with letters over the course of this, you know, 2-year journey. And Lori said, look, we need to do a webcast. And I was like, you're probably right. You know, they need to see us. They need to hear us. They need to understand a little bit more than what we can put on paper. And so that's why we're here today, is really to dig in and really inspire and teach you guys some things that maybe you weren't aware of, because quite honestly, before 3 weeks ago, I wasn't aware of some of these things. And so, you know, it was a shock to me that we had, you know, got treatment guidelines, prevention guidelines written by just brilliant and brave doctors. And I didn't know about it. You know, that was disturbing to me. And I feel like if I didn't know about it, you guys probably don't know about it either. And likewise, your primary care doctors or the doctors that are treating you or testing you for COVID may not be aware as well.
Right. So it's been an emotional roller coaster for us in the healthcare field. And to Kelly's point, as we were just chatting last week, both of us, although we have been privy to lots of information, the problem has been is what is truth? What is truth? And, if we're struggling with that, we're sure that you as the consumer who are not in the medical field are struggling with this too. So our goal today is really to walk you through some of those guidelines, to really talk to you about what you can do to empower you, to make sure that you have the tools in your toolbox for you to be able to walk this out in a more positive and a reaffirming and a healthy way. So let's get started, because we have to start with our conversation about the word resilience. It's a buzzword right now, isn't it, Kel?
Yeah, it's a buzzword. And, this is something that Lori and I have been talking about for many, many years. This whole concept of resilience is how we built our practice. Our goal for you is to live a lifestyle that allows you to have some physical reserves built up. So when life happens, because it will, when life happens, you're able to bounce back. I had a patient a few years ago, and I've told the story several times, so bear with me if you've heard it before, but she came through and did my program and did incredibly well. Just saw some gains in endurance and strength and just did really well. She and her husband were planning a trip to Greece with their friends. He was retiring, super excited about that. That was kind of her why to do the program, was to get herself ready for that trip. And 2 weeks before the trip, he had a massive heart attack and passed away. And, I get emotional when I tell the story, because I reached out to her immediately and just said, look, I'm so sorry. And when she came back in for her follow-up visit, she said, listen, his death was terrible. I mean, that was a horrible thing to have to go through. But if I had not done this program before his death, I would not have been able to manage what life threw at me during that time of navigating everything that had to happen financially, everything that had to happen logistically. She said that part I handled really, really well. I'm going through grief. It's going to be a process. But what she told me was I had resilience. I had something to pull from. And that's really what it's all about. It's all about setting up a lifestyle where you operate in such a way that when life happens, when challenges come along, you're able to pull from what you have in your reserves and you bounce right back.
Yeah. So what we know now truly is that COVID-19 is preventable. And if you haven't heard that before, we want you to walk away today knowing that it's preventable. We can prepare our bodies and we can effectively treat this virus with early intervention. And that's the key, is early intervention. So in order to have early intervention, we also have to build on a strong foundation and prepare our immune systems for the insults. Because as Kelly spoke to earlier, it's not about if, it is when. And whether it's COVID-19 or it's diabetes or it's hypertension or it's high cholesterol, or in fact, it's cancer, any of those are insults to your immune system. So this topic today, although relevant to COVID-19, the bottom line, it's relevant to your entire health and setting the framework for you to live life in abundance and feeling really, really good as you age. So our objective today is this: to provide hope and clarity, leveraging proven research and guidelines that we can protect ourselves and confidently seek appropriate treatment. Kelly, you want to add anything about our objectives today?
I think that was beautiful. I thought that was really, really beautiful. So when we think about, our immune system, the way that Lori and I have both, set up our practices is we work from a foundation of wellness. And I know you guys have heard that a lot. So don't think we're just going to go through this the same way that we have before. I really want to dig into these concepts of what does the foundation look like. So we're going to dig into how does nutrition play a part in prevention? How does your detox pathways play a part in prevention, movement, mindset, and hormone balance? And the truth is, all of these are interrelated. And I want you to be able to connect the dots because, in my early career, before I knew anything about nutrition other than calories in and calories out, I was hyper focused on movement. I was a marathon junkie, and I felt like because I ran, I could eat anything I wanted. I used my running as a coping mechanism for my stress. And so I didn't even think about my mindset other than thinking about an endurance mindset. And then hormone balance, we're going to dig into that today too, because these are so foundational in helping you set up a foundation of resilience, and then also a foundation to bounce back from something like an infection.
When addressing prevention, treatment, and healing, we really have to first look at our natural defense mechanisms. And that really does start with nutrition. I like to say it's like the chair that you're sitting in. And to your point, Kelly, many of the you guys who are on here today, some of you are consumers of our clinic already, mine at Total Nutrition and Kelly's at Enhance. And our goal is not to necessarily reiterate in a redundant, boring way. It's really to apply them so that that the things that you've been taught are the things that we need to go back to. Because right now, in the distraction of the world in which we're living in, some of us are losing that focus. So we want to pull you back in and make sure that you have that focus. And this journey that we're on today, too, for those of you who have never heard this, maybe this is the first time you're hearing this, then great. So pull a couple of things out of this information today and make a checklist for yourself. Take some action steps, because the difference between a really, really good period of time in which you've spent, whether it be in a class or maybe a one-to-one visit, the difference between being exceptional and being an average class is the fact that you take action steps. So we're going to really, really work on making sure that you walk away from here today with action steps that you're going to start doing immediately. So did you know this? 70 to 80% of our entire immune system is housed in our gut. It's housed in our gut. So basically, if we're not cultivating a positive gut health, we're suppressing our immune system. So let's get started with nutrition.
Yes, I'm going to ask you guys, how many of you, and you don't have to answer obviously, but how many of you are on a gut protocol? And how many of you really realize that that's the foundation of your immune system, right? So everything you're doing in that gut protocol, to Lori's point, is protecting your immune system, allowing your immune system to protect you, right? So nutrition, we talk about this a lot, our favorite subject, right? So food can be the most powerful form of medicine, or unfortunately, the slowest form of poison, right?
It certainly can. And so how do we apply nutrition? And I do apologize, of course, technicality wise, and I don't know if you can hear it, but someone is right outside my door. They've decided to trim the bushes of our entire community today on this beautiful Friday. So anyway, you're going to have to forgive that background noise. I'm going to mute in and out just in case until that is gone. But I did want to say, can you hear me loud and clear though? Is it okay?
It's just a lot of background.
Okay, so I'll definitely mute in just a minute. But first of all, I just want to focus on nutrition as being that foundation. It's very similar to building a house. Building a house, right? So that foundation, are we going to build it on solid ground? Or are we going to build it on shaky ground? So what does that even mean? First and foremost, if you're going to protect your immune system, you need to have healthy food. You need to have healthy food. So what does that mean, Kelly? What does healthy food mean? Because everybody's heard this.
Yeah. So when we talk about clean eating, we say farm to plate as much as possible. And that's difficult to do when you guys are eating out. I'm just going to say it. Your quality of food is going to be so much better at home. So clean farm to table eating, lean meats, chicken, fish, turkey should be the mainstay, red meat a little bit occasionally, and then whole foods. So most everything should not have a package. If it's coming out of a package, it's not truly a whole food. It's a processed food to some degree. So looking at that, how could we be doing a little bit better? And I think if we're honest, we could all say we could do a little bit better. I've had multiple discussions with my husband about chips. He just wants to bring the chips in. And I'm like, I do not need chips in my house. And so, whatever it is for you, whatever is being brought in or whatever you're bringing in, think about how can we transition that more into whole food based eating. The other thing I wanted to mention is hydration. So don't underestimate what the power of hydration does to your body. It helps your immune system work better. It helps your lymph system work better. It helps your white blood cells get to where they need to go. So if you got an insult, your body's better able to respond if you're properly hydrated. So drinking half of your body weight in ounces each day is part of your nutrition. That's like a big part of nutrition. I'm big on fruits and vegetables because they're the food for your gut microbiome. So think color. A lot of research has been done on purple colors and the things that they do to help with preventing viral illness. So think about, we don't often think about purple colors in our diet, but think about red onions and eggplant and things like that to get in. Beets even are really good. I typically will roast beets and throw them into my smoothie. So however you can get these vegetables in, please do. And then of course, thinking about sugar. One can of soda suppresses the immune system for 12 hours. Let that sink in for just a little bit. Do we have 12 hours to have our immune system suppressed when we're being exposed on a daily basis, some of us? And I'll say in Mississippi, I don't know about Florida, but in Mississippi, we like our sweet tea. That's my.
We like our sweet tea too, right? Or they'll do the half and half. And I'm like, no.
Yeah, I'll do that occasionally. I'll find myself doing some half and half, and I'm like, I really can't afford to do that right now. This is not the time to skip out on what we know to be true about nutrition. And then nutrition supplements. If you are on a nutrition plan for gut repair, that is exactly what you need to be doing right now. Because anything that you can do to create diversity in your gut microbiome is going to help those microbes work for you and helping you repair and heal from any situation, any chronic disease state that you may be developing. I want to mention some key supplements that we know have tons of research to support prevention of viral illnesses, but especially for COVID. So zinc is on the list, vitamin C is on the list, and vitamin D is on the list. What I will say about vitamin D is it's important to know where you are in order to know how much vitamin D you need. So the guidelines that we'll go over today say anywhere from 1,000 to 5,000 units a day, but that may vary depending on the person. Some of my patients, if they come into me with a 25 hydroxy vitamin D, a level of 20, or I've seen a 7 recently in midsummer, I'm going to dose them higher. Right? I'm going to dose them 10,000, sometimes 50,000 a day for a few days to get them boosted up, knowing that that's such a powerful way to prevent.
Right. Well, I interject something too, is that there's a study out of Kaiser Permanente that basically talks about serum levels of vitamin D. If they are under 55, you are at risk. So to your point, absolutely, we need to know our numbers. We need to be checking that. But the bottom line is the majority of people, in fact, 80% of our society is vitamin D deficient. So you can make the assumption that you are vitamin D deficient while waiting on getting your labs done. So I just want to make sure that you are absolutely getting that on board and understanding that you, your friends, your family, it is safe. It is very, very important to get that. That is a top supplement. Vitamin D, as you said, vitamin C, 1,000 at least twice a day, perhaps even 2,000. We'll talk more to those guidelines, but in a maintenance fashion, 1,000 twice a day. And then zinc, upwards of 50. I do have some people that are taking zinc and they're very, very they have a very upset stomach. You have to divide that into two, very similar to that of vitamin C. Number one, because zinc makes you nauseated splitting it, but vitamin C is water soluble. So it's extremely important to split that into 2 doses twice a day, 1 dose in the morning, 1 dose in the afternoon, to make sure that you're actually using that vitamin C. So that's part of that supplementation and filling in those nutritional gaps. Now, someone did ask and say, they're a family of 7 and produces are sticky. It's really tough. It looks like it's a sticky area, but I think what you're saying is it's difficult in your area. It is, and it's summertime in Florida, so produce is a challenge for us too, but really get to know your local farmers, because our local farmers absolutely have the ability to buy in bulk at less expensive rates. And so there are some things online as well. But Kelly, if you want to speak to your area, I know we have a couple of local farms that are still open, one that's closed down for the summer, but they're getting ready to reopen. But we have another one that is supplying still fresh produce.
Yeah, most of ours have ended their season, right? And they're gearing up for fall season. But, frozen, someone asked a question about using frozen fruits and vegetables. Absolutely. We've got some really good options. Even, Costco in our area is doing a really good job of stocking frozen organic produce. Mm-hmm. Putting those things in the freezer, I think that's good. Awesome. Detoxification is one of my favorite subjects, and I'll have to be honest, when I first became aware of detoxification, I used detox programs as a way to detox, and then I would retox. I didn't know how to live a lifestyle of detoxification. So if I'm speaking to someone that's also following that path, I think we can be sisters or brothers and sisters because that's tempting. It's tempting to say, I'm going to go on a detox and do a detox and then go back to doing what you were doing before, which is retoxing. So when we speak of detox, what we're talking about really is developing a lifestyle in a way that you're reducing incoming burden and that you are supporting your natural ability to offload. Okay.
So that's a daily discipline is what we like to call it. That's a daily discipline. Now, is it appropriate to step up your game and have a 7 or a 14 or a 21 day detoxification? Absolutely. Absolutely. That's just an intensification of your strategies. But for the sake of our discussion today, this is a process and it's a daily discipline in which we are reducing that incoming burden, that environmental stress, if you will, whether that be physical, whether that be emotional, whether that be candles or plugins or perfumes or sprays, or we could go into a whole hour-long class on what that looks like. But the bottom line is looking at your environment very, very closely and getting the things out that are not serving you, and bringing things in that are serving and cultivating an environment that disease can't live in. And that's the ultimate goal. So yeah, perfect. So with detox, what else do we need to do? Because one of those supplements that are on here, N-acetylcysteine, let's talk a little bit about that, right?
Yeah, so we have used N-acetylcysteine for years as a way of helping to support detox pathways, helping the body make a key antioxidant called glutathione. But we were digging into the research in the last 2 weeks and really came across some really good research to support the use of N-acetylcysteine for actually COVID prevention. And it was actually used as a standalone, which was awesome. And then it also decreases mucus in the lungs. So it's used as a mucolytic too. And so I have recently added this to my regimen on COVID prevention for myself and also for my patients that are at higher risk. So N-acetylcysteine is a compound, it's an amino acid, and it's something that helps your body make a key antioxidant called glutathione. And I know these are really big words, but it's something that your body already knows how to make. And it's oftentimes we get depleted in glutathione because of demands that our body has, just ongoing day-to-day life.
Right. And so some of the questions that we're getting is best form, where do we get it? And so there's a couple different ways, and we're going to end the seminar with what ways to get it. But on both of our websites, there is a supplement tab in which you can actually order supplementation should you desire to. However, if you are not in our areas, yes, we can ship to you. But if you're close to a local health food store, the things that you're going to want to look for is to make sure that whatever you purchase has certification of good manufacturing practices, which ensures you as the consumer that is a product that has been third-party tested to ensure that what it says on the bottle is what's actually in that bottle. So just making sure that you're looking for that specific grade of products when you're looking. But some of my favorite products, Pure, P-U-R, Pure Encapsulations, Zymogen out of Orlando. Orthomolecular is a fantastic company. And I do happen to like Designs for Health. I'm not really thrilled with their modality, the way in which they ship. We won't go into that very much, but I do like their products. So that's some of my favorites. Kelly, do you have a few of yours?
Yeah, well, I was going to say definitely Zymogen. I use Zymogen zinc glycinate, a phenomenal formula. I love that one. The N-acetylcysteine is an orthomolecular formula that I use. But to Lori's point, whatever you're using, you want to make sure that it is pharmaceutical grade and you want to make sure that it is third-party tested. Right. So we'll have information on the end of this to let you know exactly where to get some of those things if you want to. And definitely we can ship.
So practicing frequent, thorough hand washing, we should be doing that anyway, right? I think we all can agree to that.
Yeah, so in our clinic, we have upped our paper towel use exponentially with all of the hand washing. I'm like, what happened to the paper towels? But we're hand washing all the time, as we should be. And so definitely we want to make sure that's just part of what you do. And soap and water is important because of the lipophilic content. You want to use that soap so that you're breaking down that biofilm and getting it off your skin.
Great. Well, the next one is one of our favorite topics, which is movement. And you notice that we didn't put exercise here. I hope everybody notices that, because I have found historically that the word exercise is like a 4-letter word. We just don't use it. You don't like it. So we have actually just reframed, even in our clinic, the word movement over exercise, because movement should be fun. And I want to share this with you. And this is, again, research-based. There is a study that is out there that is circulating in response or in respect to COVID that says physical activity was the strongest risk factor across all outcomes compared to cardiovascular disease, cancer, smoking, all of those. The bottom line was physical activity and movement had the most and greatest outcomes. When you are doing something daily, move your body daily, at least 30 minutes, your reduction is intensified greatly across all disease states, all. So we got to get moving.
Yeah. So movement is an anti-inflammatory. And I know that's contrary to what most people think, because sometimes when they haven't been moving and they start moving, they feel a little inflamed, but it actually initiates the body's response for anti-inflammatory. And we know that COVID is an inflammatory disease state. So I say, get up and move. If you have not been moving, that is one thing that you can start doing right away to help reduce your level of inflammation.
You can't out-exercise a bad diet. We're not saying that. But the combination of those two is going to be some of the framework that needs to be set. And what we say is those daily disciplines. What can you start doing today that's going to set the stage for you to live healthier regardless of insults? So we got to move, whether it's walking, jogging, biking, riding. I know where I live, there's every group that you could possibly imagine. The gyms are reopened. If that's your thing, do it. I love my Peloton. What are some of your favorite things, Kel?
Yeah, I'm loving the Peloton because they started out with just the bike, and now the platform has everything. So there's outdoor walking, there's yoga, so I try to mix it up. I really want to get outside every day as part of my movement. So maybe I'll do a bike ride in the morning and a walk in the afternoon, but we need to be moving. So Peloton's good. I love, oh gosh, what is the other app that I have used, Lori? That's really good. That's a big platform.
Are you talking about for exercise?
Yeah.
I mean, I know we use Calm for meditation.
Right. Yeah.
Right. Peloton. I'm not sure the other one that you use.
Oh gosh, it'll come to me in a minute. I'm so sorry for showing my brain fog today.
Well, someone just asked about slides being able to be available at the end. And I just want to interject that if you can't stay on for the whole time, our intention is at the very end to have an email address that you can email and ask for the slides. That is our intention. If you are a enhanced wellness client, by all means, send them an email. If you are one of ours, you can send it to us at info@tntfit4life.com. You're also going to get, there should be an email that goes out afterwards. That's how we have Zoom set one day afterwards that has a reminder of what that actually looks like. Now, someone else asked this question, Kelly, does it have to be 30 minutes consecutive? Does it have to be 30 minutes consecutive?
So this is the deal. In order for it to be called the E word, the exercise word, it needs to be at least 20 minutes of consistent movement. Okay. But listen, do whatever you can. If you don't have 30 minutes at one block time, do it in 5-minute increments. Set a timer where you're getting up from your computer and you're taking a walk around. Any movement is good, right? Any movement is good.
Mm-hmm. Absolutely. So one of our favorite discussions has to relate to mindset. And today there may be, as Kelly opened, there have been a lot of emotions for us in the medical field. I've had days that I've come home. Let's be honest, and I'm sure many of you can relate. Is extremely tired, emotionally tired, not even physically tired, but emotionally tired. And one of the things I've had to work on in a very, very intentional way is maintaining a positive mindset. So I don't want to breeze through this prescription, if you will, this step as one of the foundational pillars to be healthy. The bottom line is, if you believe you can, you can. And if you believe you can't, you can. And this applies to every area of your life. And so I really want to talk about what's the best ways to maintain your mindset. And this could be very different in how you apply these principles, each of you differently. Maybe sleep isn't your struggle, but gratitude might be. Whatever it is, pick a few things out of here and really mindfully work on them. But we have to protect our sleep. That is number one. That's probably my hardest to do.
I'm glad to hear you say that. Sleep. She said the S word. I'm so excited for her to say that out loud.
Yes, my mind is a million miles an hour, and I'm always trying to solve problems and have solutions. And I want to be everything for everybody. And, my partner in crime on the home front grabbed me by the arms last night and said, Lori, you can't be. You can't be. But you can do your very, very best. And we need to get sleep. And we need to do that together. And so, partnering up with your loved one, your spouse, who really looks you in the eye sometimes, and you maybe to them too, and carving out what are those margins and what are those daily disciplines, not just for you personally, but as a couple and as a family. And make sure that you're talking about these with your family members and creating that awareness in your family of what you can do and what you can't do. So sleep is absolutely essential. Listen, that is when you recover. 10 p.m. to 2 a.m. That is restorative sleep. If you've never heard that term, I want you to take that home today. Restorative sleep. That is when your body repairs. That is when it uses all of the good stuff that you're feeding it. That's when it's using all of that nutritional supplementation. That is when it is utilizing all of that to recover your body so that you wake up the next morning refreshed and ready to go.
Yeah, so I want to say a little bit more about sleep. I've been wearing an Aura ring, Aura ring for a few weeks. And the data that I'm getting from it is pretty phenomenal. So to Lori's point, when you first fall asleep, you should go into deep sleep. And you want about an hour and a half to 2 hours, maybe even more of deep sleep for that whole repair process to happen. And then later in the night or early in the morning, I should say, that's when you're in the REM sleep. And REM sleep is there to help you with your memory, right? Processing memories, processing information. And so if you're not getting the right stages of sleep, maybe you're sleeping, but you're not restoring and repairing, then looking at a tool to help you uncover like what's going on and then what's the solution for it. So sleep is one of the most powerful things you can do for recovery and repair.
Right.
And so the other thing I want to say about mindset is, sometimes we take mindset for granted. And I know I went through a pretty significant challenge with my health a few years ago, and I found that my mindset of gratitude was slipping. And I had to do some things really intentional. I developed a gratitude wall in my room where the first thing I see when I wake up is just quotes of gratitude, right? I had to get things visually in my sight. And if what we're doing when we first wake up in the morning is getting on social media and we're seeing all the negativity in the world, you're training your body to be that way, right? So we really want to think about how are we setting up our life in a way that allows us to experience gratitude organically, right? And so for me, it was my gratitude wall. It really got me back on point. The other thing that I'll say, I've been really digging into Brene Brown recently. I know Lori has too. We've been doing some podcasts and some reading of books and things like that. And one of the things that she said recently that really, really struck me that I think that we need to spend time thinking about, but a life of incongruence is exhausting. It's exhausting to your soul. It's exhausting to your mind. It's exhausting to your body. Your body keeps score. And so thinking of things that you're telling yourself, one of the things that we say is keep your promises to yourself. And the reason we're saying that is be careful what you're saying to yourself and what you're doing. If you're telling yourself one thing and you're doing another thing, then that's a life of incongruence. And it can sneak into our lives so easily. But it's a suck. It's a suck of our energy. It's a suck of our spirit. And it's not the way that we were meant to live.
That's right. So how we start our day is absolutely sets the stage to our entire day. And I love what you said about incongruence. And, that's a word that many people, although maybe you've heard it before, but haven't really applied it to your health. But the bottom line is if we know these are the things we need to be doing to live well, because I think a lot of people can say, well, Lori, I know a lot of these things, or Kelly, I know a lot of these things. But the question is, are you applying it? And if you're not applying it and you're not getting the results, that's incongruence. And that leads to frustration, anger, resentment, and it leads to all of those negative emotions that literally lead to physical illness. Right. So doing a check.
The other thing I want to leave us with on mindset is, in 2 Timothy 1:7, the Bible says, God has not given us a spirit of fear, but of power and love and of sound mind. And that's kind of been my mantra recently. If I feel myself getting into fear, then I repurpose that thought. It's a time when I think about, no, God didn't give us fear. That's coming from somewhere else. God gave us power. God gave us love. God gave us a sound mind. We can make good decisions about our health and about the way we choose to live our life. So I want to leave you with that. That's been a good mantra for me. It's kept me grounded in the last few weeks, especially as things have heated up again. So I hope that helps as part of your prescription for mindset.
Yep. And I want to leave you with, without mental resilience, you'll never have physical resilience. Yeah. And I think some of the hardest work I've ever done is actually on the mental side of resilience and not on the physical side. So if you're doing everything really, really well, like I'm getting my water in, I'm getting my protein in, I'm getting my vegetables in, check, check, check. I'm doing all of that. I'm moving my body, but I still don't feel like I have vitality and energy and I'm not reaching it. And I feel like I am susceptible to things. Perhaps you really need to not only continue to work on those things, but shift your focus and working on that mental resilience, that emotional resilience. And it's not going to come easy. Some of you might be like, a gratitude wall, I can't believe that. Or journaling, I would never think about doing that. Or I'm terrible at journaling. Let me tell you, you don't have to be good at it. You just got to start it. And I can tell you that the rewards are great once you do it. So I really encourage you to do that. So let's move on to the next one, which Kelly, hormone balance.
Hormone balance, my favorite thing to talk about. There are over 600 hormones in the body, right? We oftentimes just think about our sex hormones. But truly, our hormones are a way for our body to communicate. And when I think about the situation of COVID is an inflammatory disease state. It initiates a prolonged or an unusual inflammation status in the body. And so the way our body communicates is either through hormones or through cytokines. And cytokines are your inflammation communicators, right? So anything that we can do to promote hormone balance will help your body respond properly to inflammation. Anything that we do to promote an anti-inflammatory lifestyle is going to help balance your hormones. They go hand in hand. You can't talk about one without talking to the other. And so hormones are extremely important in the way of, hormones are anti-inflammatory. I mean, that's the bottom line. They're anti-inflammatory. And oftentimes we don't think about that, but they are.
Yep. So in order to work on hormone balance, we have to use food as foundation, right? Because we know that one of the most potent hormones that we have that regulates our immune system is glucose and insulin. Glucose and insulin, right? So that's the first step, is definitely making sure that we're eating clean food. We're avoiding those starchy carbohydrates, that we're eating regularly throughout the day, and we're not allowing distractions to get in the way of food. And I'm going to be honest, Kelly and I are both transparent. This isn't about being perfect. This is about making sure that each day that we are walking through and we are reevaluating. I like to say evaluate, respond, right? Evaluate your day. How did you do? Give yourself a little grade if you want to. It doesn't have to be an A to an F grade. It could be a check or a check plus or a check minus, whatever it is for you. But evaluate yourself on a daily basis and figure out what got in the way, what were your distractions, and reapply and change things the next day. So just to summarize this area before we move into some of the guidelines that are out there that we really want to empower you with is nutrition, getting good food in, detoxification, getting good things into our body while upregulating our body's own ability to offload and making sure that our environment is more clean, if you will, less toxic. And that can be people and that can be things. We could go into great detail on that, right, Gal? Absolutely. Right. And then moving the body, then our mindset and hormone balance. Not one being more important than the other, but it's a combination of all of those, and making sure that you know clearly what your daily disciplines need to be in those areas. And if you're not thriving in any of those areas, making it a point today to make sure that you are. If you're not currently taking supplements, because historically you don't believe in supplements, and I would love to address that, because I came out of my training that supplements were a joke. You didn't need them, just eat the right food. And I'm here to tell you, our food sourcing is poor. It is poor. It doesn't contain the nutritional ingredients that we need. And then we cook it to a pulp. We change the molecular structure just in our cooking. And so you have to make sure that you are supplementing to fill in those nutritional gaps. Anything else you want to say on that before we move into the next slide?
Yeah, I think that's paramount. I was never a supplement taker prior to my education with nutrition because I just didn't, there was so much information about it's just expensive urine, right? And then I realized, the quality of the supplements really make a big difference. So that's the thing I would say is just focus on quality of supplements, quality of food the best you can, and don't be overwhelmed with all the things that we said in those prescriptions. Pick one or two things that you can build on, and then just start building that lifestyle that you want to create.
Right.
So,
perfect.
So these guidelines came from the Association of American Physicians and Surgeons. And I can't tell you, when I saw these a few weeks ago, I was ecstatic because I didn't know such things existed. There had been whispers of hydrochloroquine, there had been whispers of ivermectin. And of course, we've been talking nutrition this whole time and all the things that we just talked about this whole time, but we didn't have clear guidelines written for providers to be able to confidently prescribe medications and treatment plans for prevention of COVID and early treatment to keep people out of the hospital. So I actually had a patient that sent me these guidelines. So I want to say to you as a patient or as a participant, sometimes good things come from you, right? This is a bi-directional relationship, and we appreciate any information that you bring to us that'll give us an opportunity to investigate. Because even though I was keeping my head out of mainstream media because I wanted to keep my heart pure on this subject and content, I was keeping abreast of the things that the people that I like to follow in regards to the research. And I still didn't know about these guidelines. So if I didn't know about these guidelines, I think, well, maybe other providers don't know about these guidelines, right? So when I hear patients coming back to me saying, I got tested and I was told to go home and monitor my O2 sats, and if I get below 94, I need to go in. Not given any instruction about monoclonal antibodies, medications that they could be treating at home, supplements that they could be using at home, even hydration and movement that they could be doing to prevent something from happening, or anticoagulant therapy. None of that was being discussed, at these testing sites. And so I was like, we've got to get this information out there. So of course I forwarded this information to Lori. We both started digging into what's behind these guidelines, right? We want to see what's behind these guidelines. And so we were super excited about what we found. And we want to make sure that you have this information so that if you need a prevention strategy, and if you need a treatment strategy, you know how to talk to your providers. And you also know that there are national resources for you to get these treatments online with a virtual visit from a provider.
Right. Yeah. And to Kelly's point, one of the most frustrating things for us is that there are multiple testing sites. But at those testing sites, they're merely testing sites. And the unfortunate part is there's no guidance of what to do with those results. And I don't know if you've been caught in this. I can guarantee you probably have, or someone who has. And in fact, I know people that have unfortunately lost their lives. Hindsight is always 2020, but I just have to question is if they just would have had the proper guidelines and they would have had the proper treatment, and who's keeping that from happening. And so now we have these guidelines, because if your provider of care is telling you there's not enough research, I'm going to call baloney on that, because there is plenty of research, and we're going to show you where to go get it. If you have to provide it to them so that you speak loudly, but you need to then disseminate this information that you're hearing today to show them that there is research. There is not only empirical data, but there's meta-analysis, which are analysis over top, looking at the analysis and looking at the research and creating these guidelines. And the people that are coming up with these are very, very skilled, very, very educated providers of care that are on the front lines. Not only this one, but the other data, or the other compilation of research that we're going to share with you today. So let's move on. Let's start digging into these a little bit. And I know we're crunched for time, so I want to make sure that we get through these.
Hey,
so
Lori, before you go in that, I want to also say how much gratitude I have for the providers that put this together. This is a world team that put this together. It wasn't one person. And then they're being very brave in a world that doesn't want this information out there. They're bold, they're brave, they're getting this information out there in writing to providers to have access to.
Yeah. and they are being shunned, and they are being, unfortunately, there is an avoidance in mainstream media. Mainstream media is not being allowed to publish many of these things. And again, there's a website we're going to share with you that there's multiple videos that you can watch for yourself. This isn't about for us telling you that it's conspiracy theory. That's not it. The point is we want you to have truth. And that is our intention of today, is just providing you with truth and providing you with information you need to be confident in your conversations that are definitely happening around you.
Yep.
So I want to start out by saying there's a lot of advantages to home-based treatment, a lot. If you can stay home, please stay home. Our ERs are full of individuals that honestly don't need that care, but they're panicked. Reasonably so, and rightfully so, because they haven't had a plan in place and they don't know where to get care. So home care is absolutely safer because it reduces the risk of picking up other infections, which part of what we know, having worked in the hospital situation, is those unfortunate situations in which someone got sicker as a result of going to the hospital due to their exposure risk there. Home care allows people to have family members to come in. I think one of the biggest fears for many of you, if it wasn't, I can tell you that it was for me and it was for my family, is what if I end up in the hospital and my family members can't visit me? I'm going through this alone. And that is incredibly hard to walk through a time period in your life where you're not feeling well and the people that you love the most can't be there with you. Home care can give quickly use and widely available low-cost generic oral medications at approximately $3 a pill. So, I mean, let's be honest, there's a lot of affordable treatment that exists out there. Physicians can prescribe. They can home-based oxygen if needed, and all treatment modalities used in the hospital, except for mechanical ventilators, can be implemented at home. So home care is best. If we can keep you home, we want to keep you home, and that's by early intervention.
So what I'll say is, most viruses historically, my kids know water. I think water fixes everything. Go hydrate, lay down, it'll pass. This is not one of those viruses. You don't have to have major symptoms to have a prolonged illness. So we know that some patients are progressing to chronic long haul COVID, and they only had mild symptoms during their initial onset. So what I would say is, this is the exception to the rule that we've made historically with treating viruses. I do believe this is something that you would want to treat early. Because you don't know who's going to progress. We do know that, obesity is a major risk factor for poor outcomes. But, we have seen patients that do not meet that criteria that have also had poor outcomes. So I would say, don't wait it out with home-based care. What I'm saying is get home-based care early.
Yeah, get intervention. And so today we're going to talk about what that intervention is and finding a provider that's willing to actually treat you based on the diagnostic criteria that exists in an algorithmic form. So there should be no one saying that the research doesn't exist and they can't treat you, because they can. So we got to act early. We got to control the spread of virus. That is no doubt. Using prescription medications targeted to the specific problems of COVID-19, treating early when medications work best for infections, start with the right drugs immediately at the right time, based on your needs, and be ready to treat intensively with a full combination of these medications before critical illness occurs. So one of the things we say is get in, get evaluated early, and get treated. So here's some of the rationale, and I want you to talk a little bit, Kelly, if you would, about this exaggerated inflammatory response. You kind of alluded earlier to the word cytokine, and I think that we need to talk about that here.
Yeah, so cytokines are basically a fancy word for inflammation markers in the body. So it's the way your immune system naturally responds. So when you get exposed to a virus or a bacteria, your immune system is what's creating some of those symptoms of a cytokine flare. The achiness, the fever, all of that is cytokine driven. That's not a bad thing. That is your body responding in order to get it out of your system. However, what we're seeing with COVID is an exaggerated inflammatory response that then leads to an exaggerated situation where we can have blood clots. And so that's where it can get really dangerous for patients at high risk, especially. But really, we can have genetic variants for blood clotting that we don't know about until we get this viral illness. So I wouldn't take the fact that you're thin and lean and fit to mean that you would not respond in a negative way. Again, treatment early.
Right. And that's why the algorithm is set up that there are certain time frames. The first 1 to 5 days, here's what we do. 5 to 7 days, here's what to do. 7 to 10 days, what to do. Because in that fashion, we know that if we intervene early in that first 1 to 5 days, and hopefully 1 to 3 days, that would be better. We know that we can reduce the complications. I like to tell, and this is what I've shared with many of my patients, we either go north or we go south. And there's a pivotal period of time in which we do that. But leading up to that, those things that we do during those times will keep us in most cases in the positive direction. So it is important to kind of look at that. There are some basic groups of prescription medications we're going to talk about. We're going to do that a little bit more in the Frontline COVID Critical Care Alliance guidelines, but they are a combination of antiviral medications as soon as symptoms occur. So some of the symptoms I'm seeing recently are just what seems to be benign cold symptoms. I just have a cold. The bottom line is, if you have cold symptoms, the likelihood is it's not 100% that something else couldn't be, because of course we know that there are summer colds as well, but we don't know what we don't know. And in order to get treatment, I'm just going to say this, that it is important for us as medical professionals to have a positive test in order to do so. So I am if a person is experiencing symptoms, I am actually requiring that they get tested so that I can begin to move them through this protocol as quickly as I can. Very, very important. So just want to make that known. A lot of people are like, I just don't want to go get tested. You are limiting one's ability to safely treat you if you don't get tested. And I know I was a person in the very beginning. I will be honest that, everything was being thrown into the COVID bucket. I get it. But now that we have therapies and we are prescribing physicians, right, or providers of care with licenses, it is in fact imperative that you have a test. So I'm just going to say that. But it's a combination of antiviral medications, medicines to decrease inflammation, such as corticosteroids that have been hugely beneficial, called immune modulators, anticoagulant therapy around days 5 to 7, making sure that we are on, if you are not sensitive to aspirin, making sure that we're using aspirin, and something in the way of therapies. If you can't use aspirin, there are some natural things that do help to reduce the risk of clots as well. And then non-prescription supportive therapies, as we talked about, zinc, vitamin D, vitamin C, electrolyte drinks, such as Pedialyte. I like to recommend some of the electrolyte formulas that we have through Body Bio, more natural and not as much sugar in them, right? And then home-based oxygen.
Yeah, I will say that Pedialyte now has an organic blend. So
Okay.
you can get, Pedialyte, especially for the younger children. I think that would be the better option. But to Lori's point, Body Bio has one called E-Lite. That's an electrolyte concentrate. And I keep that I keep that in my house just in case someone gets sick, because hydration is such an important part of preventing that clotting cascade. We don't want you getting dehydrated. You're going to feel better if you're hydrated. And so forcing those fluids early on, and hydration is key.
Right. I do want to address a few of the chats that you guys have sent. I've heard great things about ALA, alpha lipoic acid. You're exactly right. It's a very potent amino acid. We know that it has regenerative properties, and we know that it has great blood sugar control properties as well. So ALA would be an add-on. I like to say it's an optional add-on to the foundational products. Is it safe for those in stage 3 kidney failure? And I was wondering what the IT was. So if you could just qualify what that IT is, if you're talking ivermectin or if you're talking the vitamins, just clarify that. We'll be happy to answer that for you. And then, can you use this to alleviate lingering congestion? There is a post-COVID response algorithm. In fact, we know for malingering symptoms, we can absolutely use some of these protocols for treatment of those things. I would recommend Mucinex over the counter. Mucinex is a fantastic expectorant. We use it a lot in COPD. And we typically used it when it was prescription strength. It was called Humabid LA, and we used 2 of them twice a day. And the over-the-counter is much less. So I would recommend, if you're using Mucinex, get Mucinex plain, brand only, and do 2 twice a day while drinking your water to enhance and aid in the expectorants for sure. You can absolutely use NAC for congestion. I'm familiar with mindset. Yes, when you think you can, you can. And I think there was a question down here about My primary only says get the shot and doesn't want to hear about prevention, et cetera. What do I do? What do I do? We're going to address that in just a few minutes. And why not prescribe ivermectin as preventative? It is moving in that direction. Andy, thank you for that question. We are moving in that direction. And I do believe we are using hydroxychloroquine as preventative at this point, 1 dose per week. And I do believe there's more research to support the use of ivermectin prophylactically as well. So do you have to have symptoms to get tested? And the answer to that is no. However, our testing centers are extremely full. And I would say that it would make sense. And this is just, I would love for you to weigh in on that, Kelly. If you are exposed and asymptomatic, and you are in a position where you are around the public, I would say in that situation, it may be very relevant to test for sure. But if you are not in that situation, you have not been exposed and you're just testing for testing's sake, I would ask you please not to do that because our testing centers are absolutely full and overwhelmed for sure.
Did you want to add? If you've been exposed and you're concerned, day 4 to 5, I would get tested just to verify. But if you're asymptomatic, I don't see any benefit to getting tested when there's not been a known exposure.
Absolutely. Good. I know we're going to run over to the hour, but I think that this is relevant. If you can hang on, please hang on. We're going to keep going regardless. We are wanting to make sure we get through this. So we wanted to talk about the Florida FL. You can see where my mind goes. Frontline COVID-19 Critical Care Alliance. This is a website that you can go to, and we really encourage you to go to it. And if I can flip through my screens in just a couple minutes, I will show you where this is. But you need to have this up. You need this to be a favorite for you. You need this to be starred because this is a very, very important building set of research. They are posting things very regularly to keep you up to speed, but they have a prevention protocol. They have an early outpatient protocol, and they have a post-COVID long hauler protocol. And it is science-based, it is research, and they are continuing to, there's evolution of that research. But this is the prevention protocol. To Andy's point, who sent in a question, can you use ivermectin as a prevention protocol? And the answer to that question is absolutely yes, we can. Vitamin D3 for prevention, anywhere from 1 to 3,000. Again, we recommend that you get tested. Vitamin C, 1,000 milligrams twice a day, but they say 500 to 1,000. That's what the research has shown. We're recommending 1,000 twice a day. Quercetin, 250 milligrams per day, upwards of 500 milligrams per day. Zinc, 30 to 40 milligrams per day. A lot of times you have to split zinc in two. A lot of our products contain zinc 25 because I know Kelly carries that zinc glycinate in her clinic as well. But you would take that twice a day. And melatonin used for sleep. It is amazing as one of your body's natural hormones, right, that we produce at night from the pineal gland to help us sleep, but it has properties of immune protection. So definitely recommend melatonin. And then gargling with mouthwash twice a day. Please don't swallow it. You can use any of these formulas. Listerine with essential oils is probably one of my favorites. I have historically just been using essential oils rather than the Listerine with because I just don't like the way that my mouth feels. But any add-ons to that, Kel?
Yeah, what I would say is these protocols are live, updated protocols. So if you see this today and you go back 3 weeks from now, it may look a little different. So to Lori's point, save this, go back to it, keep watching for revisions and changes because it's very much research-based. And as you know, the research is ongoing. The other thing I'll say about the gargling is the virus enters our body through our mucous membranes. And so gargling, if you know that you've been exposed or just on a daily practice, does a really good job of helping stimulate vagal tone, which stimulates your immune system in a good way. And then rinsing out your nasal passages too. So those strategies can be extremely powerful, kind of like washing your hands, right?
Yep. And I would add Argentine silver. Some of you have colloidal silver. I think colloidal silver, although not as a part of this protocol, but empirically just through experience at the office, I have found that to be very useful with some of your neti pots and some of those things, or just nasal irrigation or nasal sprays. We have it in all of those too. There was a question related to quercetin. I read it's potentially dangerous for those of us with hypothyroidism. Can you speak more to that? So Clay, I don't know if you want to speak to that or you want me to chat with that.
Go ahead.
Yeah, so with quercetin, again, everything needs to be done in specific amounts. And so one of the things you have to be careful of with all of these potential products is at a heightened amount of intake, you can absolutely interfere in any of your organ systems and any of your glandular systems. So at the levels in which these were actually very, very conservative, that 250 milligrams is extremely conservative. I would absolutely support that regardless of condition and in fact, even hypothyroidism. When you're pushing those limits upwards of 500 and some people using quercetin 500 twice a day, you may in fact have some changes in your lab results. And I would say that you should stick to the conservative amounts of these products, and specifically quercetin in respect to hypothyroidism. At the bottom of this slide, you're going to see, to get a full copy, if you want to take a picture of this slide, if you need that, but I will tell you that it's super easy, COVID19criticalcare.com. That is the website, COVID19criticalcare.com. There is off to the right-hand side, there's a wonderful, wonderful, I was watching it last evening again, because again, I feel so, the doctors that are involved in this research, my heart goes out to them, and they are so brave. Speaking to what Kelly said, they are incredibly brave. But there was a newscaster that was interviewing the physicians involved in the production of this protocol, and he was speaking to. He's had close to 2,000, maybe over 2,000 interviews, and many of them have actually removed out any of the questions. When he started talking about ivermectin, they would edit out that area and that discussion of ivermectin and only lift him up as the hero in saving lives out of Houston. And I don't know if you guys have heard of him, but amazing, amazing doctor. And this particular newscaster at the very end of it, and she was banned from Fox, unfortunately, but she had an independent media organization that allowed her to do this. And at the very end, she literally supported and spoke to her own media colleagues and said, you need to speak truth to the people that are putting you in your position to do these newscasts. And so you need to stand up. So it was incredibly moving. So I encourage you off to the right-hand side of that website to listen to that. This is the early outpatient protocol. Go ahead, Kel.
Yeah, so we've got a question I thought that was kind of funny about ivermectin. And I'm not laughing at you for the question. I think it's a very legitimate question, but they said, where do you get ivermectin? I thought it was a horse medication because we have had patients going to veterinary medicine to get this medication out of desperation. And we can get this from the pharmacy. We do not have to use veterinary medicine to get this medication. It has been on the World Health Organization's list of essential medicines for years. It's an old medication. It has been available. There has been no shortage. It's as simple as getting a prescription for that. And we'll show you how to do that in just a minute. So this is the early outpatient protocol. I think you guys can read this. And again, you'll have the option to have these slides. But early intervention is super important. We would just, say get on as soon as possible. If you know that you've been tested and positive, please go ahead and start a protocol that's specific for what your needs are.
And to your point, these were great replies. Do you need to discourage friends and family from purchasing from Vet Supply? Please. Please, there's 4 grades of medications and supplementations, from pharmaceutical grade to medical grade to aesthetic grade to veterinary grade. And veterinary grade is at the very bottom. And so you can't be sure that it is pure. You don't know what else is in it, and it's not controlled. So I would absolutely discourage that from happening. It's too available now in our local pharmacies. I have people that are going on GoodRx. They're getting a prescription written for 25, which is the typical standard dosing based on weight, about 4.5, 5, but 25 tabs, and they're spending, around $50 to $60 on GoodRx. Now, it depends on what part of the country you're in. That is just ours, because GoodRx changes from locality to locality to locality. But GoodRx is an app on your phone or your PC where you can get discounted rates on prescription medications. And so if you have a prescription for azithromycin or ivermectin, I encourage you to go on GoodRx, look up the amount, how much is being prescribed to you, how many pills, look around, because it's too inexpensive to risk it by ordering animal ivermectin.
So one of the things that I want to say is that if you have, say you get tested and you have a challenge with getting what you need in the way of a treatment plan, or if you get, if you really want to be on a preventative treatment plan, On this FLCC Alliance website, there is a link to physicians that treat with telemedicine, and they also have a telemedicine pharmacy. I had a patient yesterday do this, and they got their medications already. Like, it was sent to them immediately. And so just know it's pretty quick. It's easy to access, and we just want to make sure you guys know where to go to get it.
Absolutely. Yeah. And that's a common question. Where do I go in my primary care? I had a patient yesterday who's under an active treatment plan, who was in the same situation. And again, using that provider portal is extremely important. Now, remember, they are backed up. So don't wait, get on. So get with it. So ivermectin, again, we're going to go into a little bit more detail here, but ivermectin is an antiparasitic medication. Its discovery won the Nobel Prize in 2015. It has proven highly potent antiviral and anti-inflammatory properties in lab studies. And in the past 4 months, numerous controlled clinical trials for multiple centers and countries worldwide are reporting consistent large improvements in COVID-19. So perhaps you ask yourself the question, why aren't we talking about this? And why isn't this in the mainstream media? And I will only tell you this, that Merck, if you didn't know, has a new drug on the horizon. And they are seeking emergency use, and they were given a lot of money recently by our government to get that moved. And there is a lot of there is a lot of, I'm just going to say, governmental reasons why in which this is not being publicized. If you want to know more about that, I would urge you to please go on the FLCCC Alliance. They are advocating and they are actually publicizing all of their attempts to make sure that we as the public know what they are trying to do to get this. I mean, they've gone in front of Congress and they've been shut down. And you just have to know that there's a lot of time, a lot of energy, and a lot of pioneers that are out there fighting for this. And unfortunately, as we have seen historically, Big Pharma is hugely involved in what happens in respect to what we get. So I just wanted to say that to you. The WHO and the FDA is not going to approve this drug. So if you're waiting for ivermectin to be approved, I'm just going to tell you that the WHO and the FDA is not going to approve this drug. They want large randomized controlled trials, large. As you see, there's plenty of them. But again, Merck is out there with a new drug that they want approved. So just wanted to interject.
What I would say about that is that, this particular disease state, COVID, requires multiple treatment strategies, not just one. And that's a challenge with these clinical trials, getting one drug to do all the tricks, because as you see, this disease state is very complex. And so, that's been one of the excuses for not approving ivermectin as a standalone for care.
Yep. Great. Well, we wanted to leave you with this before we go into some resources and some research. If you contract COVID-19, because test results can be timely, working with a practitioner who's open to treating you based on symptoms and then determining if testing is appropriate is imperative right away. Begin journaling your symptoms. That's what we're going to want to know immediately after noticing any changes in your health. And then continue to monitor your symptoms with your medical provider. Many of you are extremely frustrated as a result of your own medical providers. And to Kelly's point, there are national organizations now through this coalition that are doing all telemedicine to get you the care that you need. So if you do not have a connection with a provider of care that is willing to treat you, you go on to the web and you seek out that. And that'll be on our next page with some of the information, but it is on the Florida Alliance as well.
So we have a question about COVID, about the vaccine recommendations as far as mitigating adverse reactions. And on this FLCC website, under the same section that they talk about long haul COVID, they also talk about treatment strategies for vaccine injury and also vaccine prevention of injury. And so I would follow that protocol as it's listed there. If there is a situation where, you're having to get vaccinated under duress there.
Yeah. And we wanted to really tread lightly today and not have a conversation related to vaccines. Really wanted to make sure that we were having a discussion specifically on how to prepare your body regardless. because vaccination is an independent decision. It is very individualized, and we want you to be empowered and know where to go so that you can adequately make those decisions. To someone's point who just sent a message, my son, a doctor's just been told he must get vaccination and he doesn't want it. It is happening all around us, from military to our hospitals. They are creating protocols in which it is being required. And it is going to take a stand on those that do not necessarily want to do that versus others. But again, today is not the time that we're planning on talking about vaccinations. We really wanted to talk mostly about where to get treatment, how to look for it, and how to empower you with the right ways to support your immune system, regardless of COVID-19 or anything, just really what you can do. So these are some of the research and resources that you can go to. Take a picture of this slide if you wish. There's a lot of YouTube videos here. There's a lot of information. Again, we wanted to arm you in understanding that this isn't to impress you with our credentials in any way, shape, or form, because we didn't do this research. We're just bringing it to you. But we wanted to create information that was powerful, that you can go back to when you're hearing from your physicians and when you're hearing from your providers of care that things aren't available or things aren't approved, if you will, that you can be strong. But time is of the essence. So make sure that you are locating now someone who is being more proactive and who is looking and following this information. So if you are out of Mississippi and you are one of Kelly's clients, or perhaps a client of a client or a friend of a friend, her clinic is Enhanced Wellness Living in Mississippi. Those are the locations where you can go for testing. And then your supplement orders, if you have any supplements that you are interested in and you're looking to purchase, you can certainly use that email address. And for a copy of the webinar, that is where you would send your request, reception.enhancedwellness@gmail.com. For those of you in Florida or have been recommended, or perhaps you can choose anyone that you want to, because Kelly and I are going to be disseminating the same information. But if you're closer to me and you are, or you're living in Florida, these are the areas that you can go to. Here is the portal that you can go to for treatment. That's the CDR Health Pro. Clicking on that particular link can get you treatment and evaluation, from testing all the way to treatment. And then our Paramount Urgent Care locally, Walgreens and CVS, are doing our testing. And then supplement orders and copy of a webinar would go to info@tntfit4life.com. So the question we got is, do either of you write prescriptions for ivermectin? And the answer to that question is, if I have a client who is in an active program, who is seeking their nutritional health and well-being, and they are under my care and they have a positive test, I am currently treating them. That's my answer. So what is yours, Kel?
Same, ditto that answer.
Perfect.
I would say that if you guys are interested in any of the supplements that we talked about, sending that supplement order at Enhanced Wellness Living, we are offering an immune bundle this month. And so those things that we talked about, vitamin C, vitamin D, zinc, we threw in a little colostrum for gut health and immune support and viral defense. If you're wanting that, please email that link that Lori gave you for supplements. We'll get them out to you. Same thing with TNT. They're offering a special as well. And so you can reach out to them to get you what you need, because, we want to make sure you guys have things at your fingertip. It needs to be easy in order for you to take action.
Absolutely. So you can go on our website. The immune bundles are there, or send an email. I know our office is closed at noon today, but we will open at 7:00 on Monday morning. But we have an immune bundle as well for kids. Actually, we have a core 4 for prevention, and then we have an add-on bundle when you are exposed or you become positive. So we have 3 levels of treatment options for you. So as we reflect on the time that we spent today, as we began to understand that, COVID-19 is going to forever impact our lives, we must consider how the stress of a global pandemic is impacting our health. And we're so glad that you joined us today to talk about how to become mentally and physically resilient. Stress is inevitable. We got to develop the mental capacity for resilience. And the first step in cultivating a mindset of resilience is keeping the promises we make to ourselves. To your point, Kelly, as you said earlier, and without mental resilience, we cannot build physical resilience. So we're so glad that you took the time today to be here with us. We hope that this was beneficial. we pray. We've prayed over this, both Kelly and I, and we've had members of our team as well as our patients who have been praying over today's webinar. This was a step out of both of our comfort zones, being completely transparent with you, not because we're not used to being in front of people, because we've talked on a World Congress stage before. And we have multiple engagements in which we talk in front of people. But because this is a very controversial topic, and we are being called to be loud about truth. And so this is God's calling on our lives today to be a part of this. And so I get a little emotional, but I'll thank you just for your time and for being a part of this. Kelly, anything you want to say?
Yeah, I want to say ditto to all of that. We prayed a lot over this as we came up with the concept and the idea, and really felt like we were being tugged to get this information out to as many people as possible. To give you confidence in the lifestyle that you're walking, and also to give you the resources that you need to pull it off. So
absolutely. Absolutely. And as we leave, I just want to show you a couple of these websites. I'm not sure that my computer is going to completely allow me to do that. But let's see here. This is the, actually, let me see if I can stop. Well, I'm not going to be able to flip to that screen. I'm so sorry, but it's FLCCC. Let me get rid of these and maybe
just Google that. It's going to come up.
There we go. Yep, right here. Yep. So COVID-19 criticalcare.com. Off to the right, if you go here to your quick links, you hit protocols. All of the protocols are listed there. Off to the right is a video by Dr. Joseph Verone. Many of you may have heard of him. He is the Houston doctor that has been all over the news. This is that media cast that I was speaking to. He's also been on the Joe Rogan show, but there's lots of information in here. Please get on this website, make it your favorite, go back over and over again, and keep reminding yourselves of stay the course, be well, live well, and let's all join together as a community to lift each other up. So you guys have a great day.
Bye, thanks.
Bye.